Good afternoon, everyone. This is Beatriz Merino speaking, and I'm going to be the speaker today. This is the second webinar of a series of webinars organized under the community of interest of ODIN project that we are going to discover in a while. And today I'm going to present the topic of change management that we did under this project. I'm going to start sharing the screen right now. Let me know if I'm sharing my screen correctly, because I cannot see the...
Yes, Bea.
Okay, everything. Okay, so I'm gonna start. So today we are gonna talk about unlocking change management in the hospital of the future, as I was mentioning before, the work done under ODIN project. So a little bit of introduction of myself. My name is Beatriz Merino. I'm a PhD in biomedical engineering, and I'm working at Life Supporting Technologies Research Group at the Technical University of Madrid. Also, I'm working in the ODIN project in the definition on the ODIN Innovation Hub. I'm also involved in the activities of change management. I leave here my email in case you need to reach me out afterwards, any suggestion or any further collaboration. So the agenda for today is the following. I'm gonna do an introduction about the ODIN project, just to set the scene and understand from where we started and where we are going. Then I'm going to explain a little bit our understanding of change management here. Then I'm going to follow up with the results under some activities that we have conducted on this topic from the ODIN perspective. And finally, some conclusions. If time allows me, I'm going to do also an interactive session with all of you. So starting from the beginning, this change management activity is framed under the European project ODIN, that basically is implementing a data-driven and evidence-based approach in hospital management to reshape processes to build the hospital of the future. So basically, the scope of ODIN is to implement this viable strategy for the introduction of the next generation health technologies, robotics, IoT, and artificial intelligence as enablers of a digital transformation to improve processes and outcomes in hospital and healthcare systems overall. So for this, we have set three main areas of intervention that we would like to implement in the hospital of the future. First of all, we are targeting what we call e-workers. So basically, we are trying to explore how to equip hospital workers with the right technologies to enhance their skills and support their daily work, routine works, basically. In this regard, technology will be used to relieve workers on the overwhelming burden of their routine activities, as I was mentioning, so that they can focus on those critical tasks, basically. Secondly, we are focused on the e-robots. So we are trying here to automate those hospital processes that no longer need humans or that can benefits of these automatizations of processes. Finally, we are targeting e-locations. So we are trying here to instrument the medical facilities so they can proactively support the hospital processes by gathering extra data and trying to understand how these e-locations also provide us with insights. We are doing this by three key target technologies, as I was mentioning in the previous slide. Basically, we are trying to involve in this reshaping of processes, Internet of Things, robotics, and artificial intelligence. So how is our technological approach behind this big ODIN project? So basically, the ODIN, we are trying to develop, or we have developed already, a platform that enables seamless communication and integration among different hospital resources. Basically, we aim to abstract away vendor-specific details to simplify operations and improve efficiency. By standardizing these components and resources across organizations, ODIN is trying to facilitate trustworthy sharing and collaboration, and of course, impacting and enhancing patient care and outcomes. So basically, we are providing universal key-enabled resources platform for the hospital of the future. We are piloting this in different pilot sites that overall we have developed 3 reference use cases in order to test this technological approach. But a question here also for the audience. However, everything is good, but how do we adopt this new technology in long-standing hospital processes smooth and efficient? So apart from the reflection, of course, we have draft or defined a methodology and an approach to achieve our goals. So first of all, we review all the technological components available within the consortium and check to what extent the needs and requirements elicited to improve hospital process can be covered. So for this, as you can see in this slide, we have developed an agile methodology from discovery to business scalability, from preparation to scale up, including the living lab perspective in 4 phases, with the final aim to deliver a value-based healthcare. On top of that, we have been working in the open innovation approach that is supporting us to put in contact through the ODIN Innovation Hub both sides of the same coin to answer the previous question that I was mentioning before. So here we have the supply side, the technological providers, and the demand side, the hospitals. The hospitals provide us through the ODIN Innovation Hub with the needs, the requirements, and challenges, and technological providers, the supply side, should answer these challenges. So the question, next slide, sorry. So I invite you to join our ODIN Open Innovation Hub and also through our community of interest in order to attend and participate in all the activities that we are organizing under this hub. You can log in this URL that is available in the website, and you can freely join us. But here comes the question that is the topic of this webinar. How do we manage change, and why? So from now on, I'm going to explain the activities that we have conducted under this big topic of change management, but with the specific perspective of ODIN. So the aim in ODIN is providing a dynamic process to build continuous trust and promote technologies trust and acceptance. So we have been assessing these 3 dimensions with a particular focus on change management, while including these 3 key enabled technologies that we have been mentioning until now. So the approach has been defined in 4 steps. First of all, we did an understanding on what is change management, basically. As a step 2, we performed 2 co-creation sessions to understand also the concept, but from the internal perspective of the consortium. The third step, we performed an internal survey in order to understand how innovations are being currently now implemented in hospitals. And finally, we did a face-to-face workshop in order to co-create and build up this change management framework to serve ODIN. Considering the first step, understanding and change management, let's start from the basis, let's say. What is change management in general? So change management is a systematic approach to dealing with the transition or transformation of an organization's goals, processes, or technologies. The purpose of change management is basically to implement a strategies for efficient change, controlling change, and helping people to adapt to change. But we need a little bit to rephrase this because we are in the context of the hospital of the future. So doing a little bit of this research, we came across with the definition. What is change management in hospital settings? Change management in healthcare involves the transition from the current state to a desired future state by effectively planning, important, identifying risk, enabling and leading teams, measuring performance, really important, and supporting continuous improvement. So based on this definition, let's see which are the current models about change management, and particularly in hospital settings that are available out there, considering theoretical models. So we have a lot of models, but I would like to highlight these 5. So first of all, Lewin's change management model that guides healthcare organizations through a 3-stage process of unfreezing existing practice, implementing change, and refreezing to establish new norms. Second, that is the well-known Kotter's 8-step change model that provides a step-by-step approach for healthcare organizations to drive change by building urgency, forming coalitions, creating and communicating a vision, empowering others, and achieving short-term wins. So several keywords here that affect directly ODIN perspective. Third is the PROSI-ADCAN model that is focused on individual change in healthcare settings by addressing awareness, desire, knowledge, ability, and reinforcement. Continuously, McKinsey 7S model that emphasizes the alignment of 7 interconnected elements: strategy, structure, systems, shared values, skill, style, and important, staff. And finally, the bridge transitions model that help healthcare organizations navigate the psychological transitions of staff and stakeholders through 3 key phases. All right, these are 5 key theoretical models to give you an insight on the theoretical models that are currently out there for implementing changes in hospital settings. I would like to highlight in the next slide the SHAPES model, that is a theoretical model rooted in human-centered system engineers or human factors and ergonomics. Because this version of the model has 3 major components: the work system, process, and outcomes, the key characteristics or factors of each, and how the components affect each on another. This SHAPES model has been used to understand and design socio-technical system and has supported evaluation, planning, and research activities to evolve freely this model while you are using. So this is also interesting for the team perspective because, as I was mentioning at the beginning in the intro session, we are also targeting e-locations. But the question here, once we understand the concept of change management and the models, the theoretical models that are out there that can serve us to build up in this concept, I would like also to emphasize the question that in these models, where is the technology? So we ask the consortium, inside the consortium, and we did several co-creation sessions to understand from a creative thinking perspective, what they thought basically in terms of how to include this technology, what is trust, change management, and acceptance from the ODIN perspective. So in this regard, we did 2 online sessions involving at least 12 participants from different organizations among ODIN project. And we did this using, in this case, the Miro board tool that is available in the website. As main results, I would like to share with you the insights from these 2 co-creation sessions. So first of all, the first question that we did is, what do you understand from trust value-based healthcare? So the answers from the participants were basically that healthcare system is which the patient trusts doctors, we trust the healthcare system, and the patient to make decisions about the medical information and healthcare decisions. Secondly, another answer that is also relevant, a common understanding of the terms acceptance and trust in relation to ODIN technologies could be that we need to measure, to implement criteria and metrics to see if we are doing this correctly. Finally, patient-oriented healthcare, that the following principle must be observed: equitable, sustainable, and transparent. Transparency is the most important point when it comes to trust, they said. Coming back to the concept, focusing on the change management in the context on ODIN, we also asked this internally with these participants, and they highlight the following. So change management for ODIN is basically the staff can adapt, educating professionals in their use of these 3 key technologies and making sure that patients are ready to trust them. Another position, change management is the entire workflow. We don't need to focus only in one piece, but understanding everything from an umbrella perspective. What is acceptance in the context of ODIN? So the process of adapting to change and the new technologies, not only now, but also for the future. And, well, to see the added value and then to use this solution, not develop everything and put it in the back of the office. So with these 2 co-creation sessions, we aim to understand from the ODIN context how we see this change management approach. Third step, we did a survey, a change management survey, that basically we did internal consultation with the hospital units that we have in the consortium, the pilot site, and we implemented 12 questions through a survey in order to understand how innovations are currently implemented in the hospital context, considering these 7 different approaches, as we are doing this cross-country. First of all, I'm not gonna go through the 12 questions, but I would like to highlight 3 main outputs. The first output that I would like to share with you is about the barriers that they identified in this survey. Basically, the most repeated ones are these ones that are in the slide. First of all, about the barriers while implementing innovations, so targeting change management in hospital settings, data governance, a lack of integration with electronic health record system. So lack of data governance in this regard. Then formalization and collaboration agreements, no rules to do so. Consider that this is the perspective of ODIN while doing this survey. The barrier to transfer the innovations to the market, the mentality and motivation of the healthcare staff in order to adopt these new innovations, and the lack of vision time and money and interest from the organizational perspective. So interesting barriers that came from, as an output from these first questions of the survey. Now, considering more in detail this question, in your organization, in the last 5 years, what percentage of innovative solutions benefit patients, professionals, and the organization? And after analyzing all the answers, the truth is that there is no clear process or clear information up to now. Basically, how to understand how these innovative solutions have been benefiting patients, but also professionals. Are they using it? Are they adopting it? Are they trained in this? And finally, the organization. The second interesting result and the second question that I would like to highlight to you is that we asked them, how do you manage the change of processes in your hospital when including new technology? They were aware about these 3 key enablers technologies. What is missing? How is being done today? Please tell us about your experience. And after again compiling the results, there is room for improvement because there is no clear answer yet. So that's why we are here today. We have room for improvement, and let's see how we asked or how we answer, this, let's say, not clear yet, given from ODIN context and framework and approach to this. So the fourth step is that we did a face-to-face workshop in order to build this framework that I was talking about. Basically, we gathered 14 participants from Spain and from Utrecht in the facilities of the Clínico San Carlos Hospital in Madrid region. And we did a collaborative approach implementing 3 different canvases to understand first the most common changes in hospital changes, what is lacking today in change management, and also understanding the pitfalls with the main objective of how does change management impact hospital of the future. So, the first results from the first changes, or the first canvas, were 7 changes. The highlights I can say that are, first of all, AI inclusion. We all know that we are now living, let's say, a revolution with artificial intelligence, and hospitals are also for sure involved. The second change that they were highlighting that is taking place right now, currently in hospital settings, is about the use of data. There are several and rapid and regularly changes on how to use data and how to access data, how to control data. On top of that, new inclusion of new IT tools in daily basis, because there are several technologies that, of course, are being developed and also susceptible to include in the hospital of the future. Also, another change is that more and more process automation is taking place. So they are a little bit dealing with this. And from COVID-19 and up to now, telemedicine also is a field that has grown exponentially in these changes. Last but not least, I would like to mention about the changes in regulation. We are in the context of health, that is a highly regulated field. And here we need to take into account all the regulations that are and more. So in this regard, they were discussing about the inclusion of the MDR, but not only this, about the AI Act and other regulations and acts that are now being released, not only about artificial intelligence, but also about AI and the quality of data that is being implemented and the access to data through this European health data space that is being taking place right now. So these are the major highlights that I can say from Canvas 1. Let's move to Canvas 2, the results from Canvas 2, that the question was, as a reminder, what is lacking today in change management in your hospital, basically? So first of all, the innovation mindset. They were highlighting several times this, not only about the professional, but also at organizational level. The trustworthiness, empowering staff that is not being implemented. One of the major component of this lacking schema is that KPI monitoring and measurement about how adoption, change management, and acceptance, while including new technology, is not being tracked in these hospitals. So we are lacking of feedback loops on these KPIs because it's not systematically implemented, and evidence-based processes to do this change management. And of course, finally, they were lacking, or they were pointing out that they were lacking trainings, systematically train staff, healthcare staff, and staff in general, and also patients in the use of these new technologies or in the reshaping of the processes. Finally, as for Canvas 3, we were asking about the pitfalls that they identified currently while doing this or while implementing change management. So they were saying that they don't have a roadmap, bad communication between teams, too many changes too quickly, and this also applies about the regulation, too many technology push, avoiding some stage of the process, lack of humanity and coordination, forgetting about environmental factors, one important one, not involving users in all the innovation chain, but doing this in the final step, and not acting upon feedback. So we are asking, they were asking, or we are asking about feedback, but then we are not implementing these feedback loops, so no acting upon this feedback. And finally, and this was the first one, but I'm gonna say that the last one, not define KPIs to evaluate the results. So after these canvases, we implement a discussion among the team there in Madrid, and we came with the conclusion that the technology, IoT, AI, and robotics is another actor of our ecosystem. So we need to build trust among the 4 actors that is here in the slide in order to manage change: patients, professionals, and organizations. But I would like to highlight one comment here, that trustworthiness refers to the qualities or attributes that make an entity, the patients, the organization, the system, worthy of trust. So, while trust is the actual act of placing confidence in that entity or hospital. So trustworthiness leads us to trust, but the presence of trustworthiness does not guarantee trust, okay? So basically, we need to implement our framework in order to assure this trust between all the stakeholders involved in managing change in hospital settings. In this context, I would like to show you here a study that our colleagues from University Hospital of Utrecht have done in this direction. So basically, they aim to investigate whether patient-physician trust is affected when a medical decision making is supported by a clinical decision support system. So basically, in general, as a conclusion, they found that patient-physician trust was high. However, their findings indicate a potentially negative effect on AI applications on the patient-physician relationship, especially among women in the high-risk situation. So trust in technology in general might increase the likelihood of embracing the use of clinical decision support system by treating technologies. A really nice study that they did, that I put here also in the slide, the reference, if you are interested to learn the full study. Finally, the ODIN proposed change management framework illustrates in this slide a comprehensive approach to digital transformation in healthcare. Basically, it emphasized the integration of these four key players: the patients, the healthcare staff, the technology, and the organizational structure. The key factors for the success of this transformation are comprised by ensuring these blue boxes, so a smooth acceptance, building trust in new technologies, and providing comprehensive training programs for the healthcare staff. The framework, in general, is guided by a digital transformation strategy that aligns these actors and factors, considering continuous monitoring over time, involving the use of 6 key performance indicators that we defined in this session to measure progress and collect feedback. These 6 key performance indicators are, first of all, feedback organization response time, satisfaction, acceptance, trustworthiness, number of process modified, and training completion rate. So finally, as key take-home message, we can say that bringing a new technology into a hospital setting means making sure changes happen smoothly. We need to train staff well so they can feel confident, and creating a culture of embracing new ways of doing this and also involving these patients. A clear communications will help us to build trust while managing, of course, resources smartly, and focusing on patient care that keeps everything running safely. And finally, by constantly checking and improving things that you are measuring through the KPIs that I have been mentioning before. So thank you very much. This is all from my side. If there is any question, I can take it right now. Yes, I can take it right now, and then we can move the audience to the interactive session. Okay, I cannot.
You can use, sorry, Bea, you can use the chat or the question and answer icon to raise any question to Beatriz.
Okay, I have opened the chat in case any question shows up now. If there is no question, I would like to invite the audience. Yes, there is one question. Very nice presentation. Thank you, Thomas. I invite the audience to join this QR. Maybe I can move to here. You can see the QR, right?
Yeah.
Yeah, okay. So I invite all of you to join the QR. This is just a last question to share among us some of the insights of this webinar, and we can see a word cloud just to conclude the session. You only need to scan the QR if you have your mobile phone at hand. If not, you can join the URL as is shown in the screen. Okay, we have one participant now. Four participants. So the question that I was asking to you, the other way around, what challenges do you foresee in implementation of IoT, robotics, and AI in hospital settings after all this information that I've been explaining now? Privacy and hacking. Interoperability, really interesting. Data privacy. Social response, really important. Building trust in technology. This is what we are trying to do here in ODIN. And also measure acceptance towards the inclusion of this technology for the reshaping of the processes in hospital of the future. Efficiency implementation, not being adaptable, of course. Okay, really nice. Acceptance by medical employees. Clinical safety, important, and also the regulations should help us in this regards. Okay, I think that we are, yes, more are coming. Fantastic. Trustworthiness. Yes, this is a major challenge also. And on top of this, how to measure this. Okay, so thank you very much for participating here. So hopefully all these insights that you are also sharing now with me, hopefully we provide now from the ODIN perspective a little bit of more information in order to answer, or a little bit of more tools in order to try to overcome with these challenges that you are highlighting in this word cloud now. So if there is no more question, that I cannot see any other questions now, recording link, please. Yes, the webinar is being recorded. I think that we can close the session here today. And don't forget to join our community of interest, because this has been the second webinar of this series, and more webinars are coming.
Sorry, Beatriz, sorry to interrupt you. It seems that we have one person that has raised the hand, Tudor. I will allow to talk.
Okay, sorry, I didn't see anything. Okay.
Tudor, you can talk if you want. Okay, it seems maybe it's a mistake. Okay, thank you. Thank you so much, Beatriz, for this amazing presentation.
Okay, thank you, everyone, and see you in the next one. Have
Thank
a
you.
nice day.
Very much.
Bye.
Bye bye.
Bye bye.